the third episode of Inside Out, where we give you bite-sized content on sexual reproductive care and lots more fun topics. I am your host, Juliana, and I can't wait to unravel, chillax, and get the conversation going. Today we have Chloe from Bridgercare, who is a nurse practitioner. So hi, Chloe.
Hello.
How are you today?
I'm good. I'm happy to be talking to you.
I'm happy to talk to you too. I think this is going to be such a good episode with lots of information that's going to be very helpful to a lot of people. So just tell me a little bit about yourself, what you do here at Bridgercare.
Yeah, of course. So I am a family nurse practitioner, and I've been working here in that role for a little bit over a year. And then I was a nurse here for several years before that. And back in high school, I grew up in Bozeman. So I'm a Bozeman native, and I used to actually be part of the peer education program when I was in high school.
Wow.
So I have a long history with Bridgercare and love this organization. So I'm happy
That's
to
awesome.
be here.
Yeah. Okay, so one of my other questions is what is your favorite fall drink? I love to ask this from everyone, and it's technically still fall right now because we haven't had snow yet.
It is.
Yeah, so what's your go-to fall drink?
Well, I guess I'm going to speak to this fall specifically, even though I guess this is technically a winter drink, but I've just been very into hot chocolate lately. Like, it's been my, well, maybe not nightly, but I've been drinking quite a bit of hot chocolate this fall. I don't know why, but yeah, that's my thing.
Hot chocolate is kind of like the transitional drink between fall and Christmas and winter. So
exactly.
That's awesome.
Yeah.
Okay, so we're gonna dive straight into our questions. So tell us a little bit about the birth control methods. You know, what are they? A brief overview of what each method is and the general side effects of it.
Yeah, for sure. So there are many different contraceptive methods, so there's kind of different categories. And, one of those categories we call the long-acting reversible contraceptives, or LARCs for short. So those are things like the IUDs. There's a couple different hormonal IUDs, and there's a non-hormonal IUD. So those ones are long-term, ranging from 3 years up to 12 years. The Nexplanon arm implant is also in that category. And then we have some methods that are called combined hormonal contraceptives, meaning they have estrogen and progesterone. So there's things like the typical pill that you've maybe heard about, the NuvaRing, and the contraceptive patch. And then we have a injectable contraceptive called Depo-Provera that lasts for 3 months. And then there's several barrier methods too, like condoms and a diaphragm, and then fertility awareness. So a really wide range of options, and hopefully, ones that fit a variety of people's needs.
Yeah. So would you say that most people start with birth control pills when they first kind of look into contraceptive methods, or do you kind of talk to the patient and see what their needs are and how do you what method fits into their lifestyle?
Yeah, exactly. So there's not necessarily one right method, and it is very individualized to a person's specific needs and their plans for children in the future and how important it is for them not to get pregnant at this moment in time. Kind of what side effects they might be concerned about or experienced in the past with other methods, how their periods are and what they want those to look like. So their medical history. There's a lot of things that go into that conversation when we're trying to pick what the right method is for that person, but ultimately always, the person's decision, what's going to fit best. So I think a lot of people do start with the pill first just because it seems more approachable, or maybe they have more experience with it, but not necessarily. We also have people who are 17 and never been sexually active and go right for an IUD. So it totally just depends on the person.
What would you say some of the side effects are for just in general?
Totally. So while it does depend on the method, in general the most common kind of hormonal side effects a person might experience is maybe some nausea, some breast tenderness, some mood swings, headaches, And then those, usually they're mild, and as you adjust to being on the birth control, they usually will go away. So we usually recommend trying out a birth control for about 3 months, knowing that those often go away with time. Other things can be like bleeding irregularities or cramping, things like that, which also generally kind of improve with time.
Would you say those symptoms are kind of the same for copper IUD?
The copper IUD specifically, that's the one that doesn't have any hormones, and one kind of expected side effect with that one is that it can increase like menstrual bleeding, like the flow of your period, and then also increase cramping. And that doesn't happen for everyone, but definitely a kind of main side effect that we counsel people on.
So can Bridgercare prescribe or like talk to people about birth control other than for sexual purposes?
Yeah, absolutely. So, you know, obviously a lot of people do use birth control for pregnancy prevention, but we also see lots of people who aren't currently sexually active or don't plan to be, and use it for things like acne. So the birth controls that have estrogen in them can be really beneficial for skin. So I'd say that's a big reason that people might come in and start on something. Also like regulation of periods, like if someone has really irregular cycles or really especially like heavy cycles or painful, there's several methods that can help reduce like bleeding and cramping.
All right.
Yeah.
So moving on to the second question. So what if someone forgets to take their pill at the same time every day, or just forgets one day?
Yeah, so usually we encourage people to call in and kind of talk to one of the nurses or one of us about this, because it can be kind of tricky just depending on the scenario. But in general, if someone forgets a pill, the recommendation is that as soon as they remember, they take it, even if that means like doubling up and taking 2 pills in one day.
Okay.
And if someone does that just very occasionally, like hopefully it's not going to affect the effectiveness of the pill. But if someone is struggling and realizing they're forgetting and, you know, missing pills or having to do that frequently, then we might open up the conversation about if maybe non-daily birth control might be a better option, just because we worry about just the pill being less effective if someone is missing it or being late for their pills frequently.
Yeah. So when you say a non-daily pill, I wasn't aware of this. So there are pills that you don't take every day?
No, there's no pills that you don't take every day, but there's other birth control. So someone might decide to switch to like the NuvaRing, which is monthly instead of daily. So just something where, you know, we all have very busy lives, and it can be hard for a lot of people to remember a pill every day.
Yeah.
Yeah.
So if someone were to stop taking birth control pills, can they conceive right after, or do you still have to continue with the placebo pills and see how your body adjusts to the change before you try to conceive or try to...
That's a good question. So, yes, with any of the birth control methods, it is possible to become pregnant pretty much immediately when you stop. So the hormone dosages in these methods are low and get out of your system pretty quickly, and so someone's regular like ovulation and menstrual cycles typically return fairly quickly within a couple months afterwards. So they would return to like whatever their baseline kind of fertility was after stopping. So, and I mean, that's the reason too that it can be a bit easier to accidentally become pregnant on the pill with just like a missed pill, because those hormones, you know, they leave your system pretty quickly, and then a person might ovulate from just missing the pill, and then they'd be at risk for pregnancy. So to answer your question, a person could become pregnant right after stopping any of these methods.
So let's say someone is with the same partner but is on birth control, but they decide not to use any of the barrier methods. Would that pose as an issue in terms of like getting pregnant, or is that kind of like safe because one, you're with the same partner, so you're not getting any sexually transmitted diseases, and two, you are still on birth control?
Yeah, so this is also just a very individual decision. But yeah, some people decide to use condoms in addition to their hormonal birth control method, and others choose not to. most of these methods, if used perfectly, are more than 99% effective in preventing pregnancy. So, again, kind of an individual decision, but a lot of these methods are effective on their own. But, if it's just really important for someone to prevent pregnancy at this time, moment in time, people choose to use condoms in addition to their birth control, So just another very individualized decision. Yeah.
So will birth control cause weight gain? I know this is kind of the $1 million question. Is it a myth or a fact?
Well, both in a way. So there is conflicting and limited research about, I guess, kind of proving that birth control causes weight gain. So in the study, most of the studies that have been done, like, the amount of weight gain reported is minimal. So let's say 5 pounds in a year. So it can be difficult to correlate that with the birth control specifically, because there's so many other factors that can influence weight, and people just generally gain weight over time, and it can be hard to
measure just
say,
that one
is
quantity.
This specifically the birth control causing this? And so no, in general, it is not an expectation that a person will gain weight on birth control, but, in real life, we certainly see people who are having that experience. So it is a reasonable side effect to, cause someone to want to stop their birth control method or talk about other options. But there are, some limited and conflicting research on that one.
Fair enough.
Yeah.
Can birth control cause hormonal infertility? So meaning if somebody were to be on birth control for, let's say, 12 years and then they decide they want to have kids, so can that affect your fertility rate?
Yeah, that's a good question, and I feel like one that gets asked a lot. And no, there's no evidence that any of the birth control methods cause fertility issues. The one kind of side note to that would be with the Depo-Provera shot, there can be a delay in when people are able to get pregnant afterwards. It just takes a bit longer for that hormone to metabolize out of someone's system. So it can take about 10 months average after stopping for someone to conceive for that specific birth control method. So that's a conversation we have, and those people who are using Depo, and we do talk about their reproductive life plan and when they're maybe thinking of trying to become pregnant. But so that's a little caveat with that method, but it's still not impacting their ability to get pregnant. It's just a kind of delay. But overall, no impacts on fertility.
Awesome. So do copper IUDs make your periods worse?
Yes, in general, this is it's not a guaranteed effect of the copper IUD, but it is one that we definitely counsel about, and it is likely that in those first, especially 6 months, maybe even to a year of the copper IUD, that someone might experience heavier, longer, or more painful bleeding. So just definitely so people are expecting that and not, taken by surprise. It's definitely a conversation we have, and if you came in and were really struggling with very heavy or painful periods, that might be one reason that we might not discourage you from using it, but just kind of open up that conversation about what your periods might honestly look like with it.
Okay, so what happens if someone leaves their IUD past the date that it's supposed to be removed?
So we've definitely seen this. Sometimes things just get busy and people forget to have it taken out. The biggest thing would just be that it might not be effective. So there's specific durations that we know have been studied for effectiveness, and some of those have been extended recently, and there's certain devices where now, for example, the Mirena IUD, it's FDA approved for 5 years, but we know from all of the research that has been ongoing that it is effective for up to 7 years. So that, we have that conversation with people, but if someone had it in over 7 years, the main concern would just be that it's not at its full effectiveness. And other than that, in general, nothing bad is going to happen if you accidentally
good to know.
left it in for too long.
Yeah.
We've removed IUDs that have been in for, many, many years, and I suppose there could be, a slight risk of it getting embedded in the uterus or something like that, but that'd be pretty uncommon.
Can that cause, like, some kind of sensitivity or, like, irritation?
In general, not. The people I can think of, we're not having any negative side effects or anything. Yeah.
Okay. So do you need a pelvic exam to check if, like, your IUD's in place, and just like a yearly pelvic exam, is that recommended?
Yeah, so about 6 weeks after someone has an IUD placed, we offer an IUD check. It's not a requirement. If someone's doing great and has no concerns, they don't have to come in for a check, but some people just like the reassurance of, we just insert a speculum, we're checking the IUD strings and just kind of checking in on how things are going. So optional IUD checks at any point, and then in general yearly we recommend yearly visits for most people. And then certainly we talk about the things that might be more concerning that would warrant you needing to come in to have it checked. So kind of symptoms to look out for.
If it moves from the original place, can you feel it? Can you tell something's wrong?
Yeah, so the risk of it expelling, which basically means that the IUD is moving downwards in the uterus, the hope is that, yes, you would have some sort of new symptom to clue you in. So you might start having, cramping or pain out of the blue, or heavy bleeding, or discomfort with intercourse or something like that. That might prompt someone to come in and have it checked out. Yeah, but luckily that is a low risk situation.
Speaking of the IUD string, can your partner feel the string? Is that, if it's too low, or, I don't know, it's dangling in there?
Yeah, good question. So we trim the IUD strings to be, in general, about 3 centimeters from the cervical os. So, and these strings, they feel kind of like fishing line to me. And they do get softer over time, just because of cervical mucus, and they kind of get tucked up kind of behind the cervix. So some people, if they try to check their own IUD strings, are able to feel them. Other people really have a hard time with that, which is fine. Sometimes partners complain about maybe being able to feel the IUD strings, but again, because they're so soft, they're generally not causing discomfort for anybody. If the IUD was coming out of the cervix, someone might feel the pokey tip of the IUD, or feel the strings were really, really long inside the vagina. So those would be reasons to definitely come in and have it checked.
So when you remove an IUD, do you feel the same pain as when it's inserted?
It's generally not as bad as the insertion. So the IUD removals are usually fairly brief. We just grasp the strings with a little ringed forceps, and most people feel one brief cramp when we pull it out. So most people tolerate it really well.
Okay, so can you switch between different birth controls if something doesn't work out? Absolutely.
So people come in to switch their birth controls all the time for a variety of reasons. But it's very simple and totally fine to switch between methods. So let's say, if you got your copper IUD and you gave it 6 months and we're just having a really hard time with heavy or painful bleeding, and you kind of came to see me today and decided you wanted to switch the pill, no problem. We pull the IUD out, I give you the pill. So that was just one example. But yes, people switch for a variety of reasons, and we try and make that a smooth process.
Sounds good. What are some factors that can interfere with the effectiveness of birth control?
That's a good question.
It's a very broad question, too.
The biggest thing that I can think of would be someone, kind of what we were talking about. So basically using the birth control incorrectly. So and this goes back to, there's kind of the perfect effectiveness with birth control, which I was saying is for most of them more than 99%. But then there's also this typical effectiveness of us humans are not using our birth controls perfectly, and that's what's impacting their effectiveness. So if I miss a pill, if I'm late to go pick up my birth control pills, or I'm having an issue with my provider's office and they, I'm having a hard time picking up my refills and I, start my new pill pack 5 days late. Or I leave my NuvaRing in for too many weeks, or I'm late to come get my Depo shot, or those kinds of factors are the main things we're seeing that are impacting effectiveness. Okay. There's also a few uncommon medications that can interfere with birth control. So those, we're always asking people about what medications they're using when we start them on something. So we're making sure they're not using something that might cause it to be less effective. Yeah. One kind of common, well, I was going to say that one kind of common myth is that antibiotics
That's what I've heard too.
Or make birth control pills less effective, and that is actually not true. Yeah, there's like 1 or 2 antibiotics that are rarely prescribed that can impact it, but those are not the typical antibiotics that someone's getting just for like a UTI or strep throat or something like that. Yeah.
Okay. Thank you for sharing that. Yeah. So that brings us to the last question. Yeah.
Let's hear it.
So can someone be on birth control if they are older than 35 and closer to menopause?
Absolutely. So, people of all ages use contraceptive methods. So, teenagers all the way to people in like the menopausal transition, and there's just like at any age, there are some things that would be reasons that it'd be unsafe for someone to use birth control after 35. The biggest thing that comes to mind is if someone's over 35 and smokes cigarettes or uses tobacco, it's not safe for them to use an estrogen-containing birth control method because there's an increased risk of blood clots and strokes. So that's just one example of like, something that might be a reason why someone couldn't use a specific method after 35. But in general, yes, you can use birth control methods for a variety of for many, many years. And there's actually certain options that can be really helpful for people who are approaching kind of like the menopausal transition to help with maybe like irregular menstrual cycles or heavy bleeding or some like hormonal fluctuations. And a lot of these birth control methods have like non-contraceptive benefits. We talked about some of them, but they can help prevent like endometrial cancer and ovarian cancer. So variety of reasons why we actually might use them later in life for people. So yes, if you're over 35 or if you're in the menopausal transition and still at risk for pregnancy or even not and using it for other reasons, it's totally an option. Yeah.
So just going back to the same question. So if someone were to consider going on birth control after they've had kids, but they don't want any more, is that still an option for them?
Yeah, absolutely. And again, really, still a variety of options would be available. Some people choose at that point to use like the permanent birth control method, so something like a tubal ligation for someone who has ovaries and fallopian tubes, or vasectomy. So those are more if
like
you're
the permanent solution.
For sure. No, you don't want to have any more children. Those are good options. But the IUDs actually have pretty much similar effectiveness to those methods. So some people choose to still use like a method like that, a hormonal method, if they have no plans for more children. So,
awesome. So can you tell us a little bit about the services and the sliding fee scale that we have at Bridgercare?
Yeah, of course. So Bridgercare operates on a sliding fee scale, which just means that we assess everyone if they choose to want to look into the sliding fee scale. We assess someone's income to determine if they might get a discount on services. So income-based fees, which is really nice. So, and in general too, our prices here are lower than a lot of places in town. So it can be helpful for people who don't have insurance or if their insurance doesn't cover the total amount, they might be eligible for a discount on some of their services.
Okay.
Which is super helpful.
Yeah, that is. What are some common services people come here for?
Yeah, so we obviously talked about contraception.
Yeah.
Also STI screening, annual wellness exams for people of all genders. We also have Dr. Casper here, who does genetic counseling and infertility assessments, and we have the ability to do pelvic ultrasounds. We have a colposcope, so we do colposcopies. We also provide gender-affirming care and hormone therapy. I'm sure there's a million other things I'm forgetting. Pregnancy testing, immunizations. Anything sexual and reproductive health related. We also provide like mental health services. We have
just a wide variety,
but sexual and reproductive health focused.
Definitely.
Yes.
Well, that sounds like a really good option for people to consider and just think about the wide variety of services Bridgercare offers, as well as your sliding fee scale, so you don't have to worry about feeling uncomfortable with certain services that you want to receive, or feel kind of uncomfortable with like paying excessive amounts for these services, because I think everybody should be entitled to get all of these. So feel free to check out Bridgercare or call them and schedule an appointment as soon as you can if you're interested in any of the things that we've talked about today. And Chloe, thank you so much for your time. This was great. Some of these questions I didn't even know the answers, so this was great for me to learn, and I know a lot of people would definitely appreciate your information. So thank you again.
Yeah, of course. I love having these conversations, so thanks for inviting me.
Yeah, no problem. So that's a wrap, guys. I hope you guys enjoyed this episode, and I can't wait to talk to you guys soon in another episode. Until then, this is Juliana signing off. Bye-bye.